Hello friends, welcome to NEET PG Live Daily. Am I audible? Okay. Hello friends, welcome to NEET PG Live Daily. Myself Dr. Apoorva Mittal and I am your educator for Anesthesia on this platform for Unacademy. And today we'll be discussing about cardiac monitoring part 1. In this lecture, I'll be covering just the basic part, that is the physiological part of the cardiac cycle and the jugular venous pressure, because till the time we don't understand these two topics, we can't understand about the central venous pressure monitoring and why is it done. So today I'll be just discussing about the physiology of the cardiac cycle and I'm so sorry, and JVP. So let's start our today's class. But before that, let me introduce you Unacademy Plus. By getting the Unacademy Plus subscription, what are the advantages? You will be able to avail the live classes for all the 19 subjects and also interact with the educator for the same. Also, we'll be having daily test series and analysis through which you can evaluate your progress and also come to know how the questions are asked, and also live doubt clearing sessions in which you can clear the doubt pertaining to that subject. So friends, let's start our today's topic of uh, cardiac monitoring part 1. uh, okay, so today, as I discussed before, we'll be just seeing the cardiac cycle, okay, then the jugular venous pressure and also the abnormal JVP waveforms. Tomorrow we'll be discussing about the blood pressure monitoring, the non-invasive and the invasive blood pressure monitoring, also about the central venous pressure monitoring, in which the JVP will be very important, and then we'll be discussing about the cardiac pulmonary catheter. So all these things we'll be discussing tomorrow. Today we'll be discussing cardiac cycle, jugular venous pressure and abnormal JVP waveforms. Is it clear? Is it clear? Am I audible? Okay. So, coming to the first topic for today, that is cardiac cycle. Okay, the cardiac cycle. In this, first we have to remember that cardiac cycle is about the ventricular event. The first and the foremost thing, whenever I talk about the cardiac cycle, that is, I'm talking about the ventricular event. Okay, um, and the normal duration of the cardiac cycle is 0.8 second. Dr. Sejal and Dr. Ehsan, welcome to the class. If any doubts in any topic, please let me know. Okay, so ventricular event, the normal duration is 0.8 seconds. The ventricular systole is 0.3 second. Okay, ventricular systole is 0.3 second and ventricular diastole is 0.5 seconds. So that means the diastolic time, the ventricle in the diastole is for more time as compared to the ventricular systole. Okay, so 0.5 and 0.3 second, that is cardiac cycle is 0.8 second. If we see in terms of the atria, right, the atria systole is only 0.1 second and diastole is 0.7 second. Okay, so this is the normal how the cardiac cycle is divided. Normal duration, always remember, it is 0.8 seconds, and always remember, whenever I'm talking about cardiac cycle, I'll be talking in terms of the ventricle. If I'm telling systole, that means ventricular systole. If I'm telling diastole, that means ventricular diastole. So I'll be talking about the ventricular event in the cardiac cycle. So first, the phases of the cardiac cycle. Okay, the phases of the cardiac cycle will be starting from this point. Okay, this point, see, this is the ventricular diastole, that is, ventricle is in the relaxed state. Okay, we'll be first talking about this light green point and then we'll go towards the ventricular systole. Okay, so first phases of cardiac cycle, that is when the ventricle is at the end of systole or start of diastole. तो वेंट्रिकल जस्ट अभी कॉन्ट्रैक्ट करके चुका है और रिलैक्स होना शुरू हुआ है. Okay, at the end of systole, systole means ventricular contraction. So end of systole and start of diastole. Okay, so in that the first event is protodiastole. Okay, protodiastole, remember, it is just starting off the muscle relaxation. Okay, it is just starting off the muscle relaxation and it is end of systole. तो systole के वक्त क्या हो रहा था? Systole के वक्त the semilunar walls, okay, were open. So end of systole में क्या होगा? The semilunar walls are already closed. Okay, it is closed. So starting of the muscle relaxation will be closure of the semilunar walls and the AV walls are already closed. Okay, the AV walls are already closed. So that is protodiastole. Are you getting my point, Dr. Ehsan, Dr. Sejal? Are you getting my point? Any doubts in this? So protodiastole, okay, it is just the start of the muscle relaxation, which is followed by the closure of the semilunar walls. Okay, the AV walls, the tricuspid walls are already closed because ventricle is into the diastole, and that will have, because both the walls are closed. Okay, both the walls are closed, the AV and semilunar walls, both of them are closed. That means ventricle is neither getting any blood nor blood is going out of the ventricle, right? Ventricle is not getting any blood from the atria, nor any blood is going towards the pulmonary circulation or towards the aorta. That means ventricle is under isovolumic relaxation. Is it clear? Is it clear? So that means isovolumic relaxation. So these are the phases of the cardiac cycle. Okay, the first phase we will start. Always remember, I'm emphasizing on this because you have many doubts. Always remember, start with the ventricular diastole, that is ventricular relaxation. ठीक है, ventricular relaxation में सबसे पहले क्या आएगा? Isovolumic relaxation. That means दोनों के दोनों walls, the semilunar walls and the AV walls, they are closed. Ventricle is neither getting any blood nor the blood is going out of the ventricle. ठीक है? Now, at the end of isovolumic relaxation, जब isovolumic relaxation हुआ है तो ventricle में ना तो blood आया ना ब्लड जा रहा है. जितना ब्लड था उतना सब कुछ चला गया. अब नया ब्लड कुछ नहीं आया. तो at this point, at the end of isovolumic relaxation, the ventricular pressure is lowest. The ventricular pressure is lowest, right? But अभी तक atrium में क्या हुआ? Atrium में बहुत सारा blood आ गया. The atria is full of blood. And now compared to the ventricular pressure, the atrial pressure is more. Are you getting my point? Are you getting my point? At the end of isovolumic relaxation, what happens? Ventricle का जो pressure है, that is at the lowest. Atria has full of blood. So as compared to the ventricle, now the atria has more pressure and therefore there is opening of the tricuspid wall. That is opening of the tricuspid wall. And atrium में इतना सारा blood भरा हुआ था. इसको कैसे याद रखेंगे? Compare this with a oil bag. ठीक है, जैसे कोई सा भी खाने का तेल है, उसका जब हम लोग पैकेट जस्ट खोलते तो उसमें फुल वॉल्यूम होता है. बिकॉज ऑफ दैट वॉल्यूम, ठीक है, इवन अगर हमने उसको थोड़ा सा भी उल्टा किया तो सारा का सारा ऑयल उसमें से फ्लो होने लगेगा. ठीक है, सो बिकॉज द एट्रा इज फुल ऑफ ब्लड, ठीक है, it is full of blood, the blood will enter rapidly from the atria to the ventricle as soon as the tricuspid wall opens. Is it clear? So blood will enter passively and this is passive ventricular filling. The atria does not have to contract at this time. Atria में इतना ब्लड है कि इजीली बिकॉज ऑफ द प्रेशर ग्रेडियंट एट्रिया से ब्लड वेंट्रिकल में आ रहा है. सो रिमेंबर इट इज पैसिव वेंट्रिकुलर फिलिंग. देन इट विल एंटर इनटू डायस्टेसिस. डायस्टेसिस इज स्लो फिलिंग. ठीक है, उल्टा किया, ऑयल को जितना वो निकल सकता था उतना निकल गया पैसिवली. अब वो धीरे धीरे आएगा क्योंकि उसके अंदर थोड़ा सा ऑयल कम हो गया है. एट्रिया के अंदर भी ब्लड थोड़ा कम हो गया एंड द प्रेशर ग्रेडियंट इज लो. The pressure gradient is low and at this time both the atria and the ventricle relax. Is it clear? Is it clear, Dr. Sejal, Dr. Ehsan? Is it clear? Any doubts in this part? Please give me a thumbs up if it is clear. So I started with this point, that is protodiastole. Okay, it is end of systole, starting of the relaxation. ठीक है, तो क्या हो रहा है कि सेमील्यूनर वॉल्स एंड द एवी वॉल्स आर क्लोज्ड. ठीक है, तो उसके में क्या हुआ, आइसोवॉल्यूमिक रिलैक्सेशन. फिर एकदम से, ठीक है, वेंट्रिकल का तो प्रेशर कम है, एट्रिया इज फुल ऑफ ब्लड, देयरफॉर ओपनिंग ऑफ द ट्राइकस्पिड वॉल्व हियर, there will be opening of the tricuspid valve. ठीक है, and therefore the blood will enter rapidly into the ventricle. ठीक है, this is the early filling phase and this is passive in nature. After that it will enter into the diastasis phase. Okay, now the last phase में क्या होगा, क्या बताया था कैसे करना है, ऑयल के बैग के साथ. ठीक है, अब उसमें से प्रेशर ग्रेडियंट ऑयल खाली हो गया, लास्ट में अपन क्या करते हैं, उसको ऐसे स्क्वीज आउट करते हैं उसमें से, है ना, कि ऑयल कहीं रह ना जाए. सो दैट इज कंपेयर टू द लास्ट फेज. दैट मीन्स नाउ द एट्रिया विल कॉन्ट्रैक्ट. ठीक है, एंड दैट विल अकाउंट फॉर 30%. Remember, last stage the atria will contract and that will account for 30% of the total ventricular filling, and this is the active process. What you have to remember in this also is when the heart rate increases, ठीक है, whenever जब हार्ट रेट इंक्रीज हो रही है तो क्या हो रहा है, डायस्टोलिक टाइम कम हो जाता है. ठीक है, so remember it is the duration of the diastasis that is slow filling and the first rapid filling it decreases, but the active phase, the last rapid filling phase, it remains constant. Please remember this. Dr. Muhammad, Dr. Ehsan, Dr. Sejal, is it clear? So now I just spoke about the ventricular relaxation. Okay, ventricular relaxation or ventricular diastole. So ventricular diastole has 3 parts. Okay, and has 3 parts, that is isovolumic. Okay, isovolumic relaxation is there. After isovolumic relaxation, okay, Dr. Sejal is asking me to repeat once again. Okay, so I told you ventricle, okay, ventricle will relax. I am talking about the ventricular diastole. That means ventricle is in the relaxed state. It will get the blood. कहाँ से blood मिलेगा, उसको tricuspid valve जब खुलेगा और the AV valve will open, it will get the blood, right? So whenever, first we will start with end of systole and start of diastole. As it is end of systole, so at that time, okay, at this time, end of systole, at this time, already the AV walls are closed. And now the semilunar walls will also close and that will lead to isovolumic relaxation. Is it clear? Now, at the end of isovolumic relaxation, what will happen? The ventricular pressure is very less and the atrial pressure will be more because atria was going on receiving the blood, right? So, atria का pressure ventricle से ज़्यादा हो गया, pressure gradient is there. So, what will happen? There will be opening of the AV valves, right, Dr. Sejal? There will be opening of the AV valves, और जैसे AV valve open होगा, rapid filling phase होगा, ठीक है, ventricle में एकदम से rapid filling phase of the ventricle will happen, and then that is passive. Then there will be slow filling phase, that is diastasis, and after that थोड़ा सा जितना भी ब्लड बचा है एट्रिया में वो कॉन्ट्रैक्ट करके वेंट्रिकल में ब्लड दे देगा. दैट इज सेकेंड रैपिड फिलिंग फेज और द लास्ट फेज, एंड दैट इज द एक्टिव प्रोसेस. डॉक्टर सेजल, इज इट क्लियर? Is it clear? Any doubts now? Any doubts? Now, at the end of diastole, ventricle के अंदर end diastolic volume बचा, end diastolic volume बचा. Now, ventricle में सारा blood आ गया. Okay, ventricle has full blood. Now, what will do? It will enter into the systolic phase. It will enter into the systolic phase. That means ventricle will now contract. Okay, ventricle will now contract. When the ventricle contracts, what will happen? Ventricle contraction hoga. The pressure will increase. The pressure will increase, and because of the increase in the pressure, the AV valves will close. The semilunar valves are already closed, right? The AV valves were open. Now ventricle में बहुत ज़्यादा blood आ चुका है. The pressure will increase because of the contraction, and the AV valves will also close. That will cause isovolumic contraction. Isovolumic का मतलब हुआ ना तो वो blood receive कर रहा ना उसमें से ज़्यादा जा रहा. It is same. Okay, so that the volume is same. So that will enter into the isovolumic contraction. ठीक है, अब ना उसमें से जा रहा था ना उसमें से आ रहा था. वेंट्रिकल के पास बहुत ज्यादा ब्लड है, सो उसकी वजह से एट द एंड ऑफ आइसोवोल्यूमिक कॉन्ट्रैक्शन द वेंट्रिकुलर प्रेशर इज वेरी हाई. इतना ज्यादा हाई है कि उसकी वजह से अब क्या होगा? द सेमिल्यूनर वॉल्स, द आयोटिक और द पल्मोनरी वॉल्स, they will open, and therefore there will be ejection of the blood, 2/3 ejection, that is rapid duration. Okay, there will be ejection of the blood from the ventricles either towards the pulmonary circulation or into the systemic circulation. Is it clear? And after that 1/3 of the ejection, that will be slow and the duration will be more. Is it clear? Is it clear? Isovolumic relaxation, then isovolumic contraction, then after that there is opening of the semilunar valves, and therefore it will enter into the ejection phase. It will enter into the ejection phase. Okay, so is it clear? The cardiac cycle, is it clear? Any doubts in this? Dr. Sejal, Dr. Ehsan, Dr. Muhammad, any doubts in this? Okay, now if I compare the cardiac cycle along with the heart sound, if I compare the cardiac cycle along with the heart sound, the first heart sound, see, the heart sounds are because, remember, it is because of the closure of the valves. Easy thing. Okay, the first and the second heart sound, it is because of the closure of the valve. Okay, the first heart sound is because of the closure of the AV valves. Okay, it is because of the closure of the AV valve, and as I told you, closure of the AV valve कब हो रहा था? Just before the isovolumic contraction. Okay, so the first heart sound is because of the closure of the AV valve, that is just before the isovolumic contraction. तो C पहले आता है, right? C पहले आता है, तो that is for the first heart sound. Then R बाद में आता है, right? Alphabetically R is after, so that is responsible for second heart sound, and that will be closure of the Dr. Ehsan, the first heart sound is known as lub. The second heart sound is known as dub. Yes, yes. The first heart sound is known as lub. The second heart sound is known as dub. Okay, the second heart sound, it is just before the isovolumic relaxation. That is because of the closure of the semilunar valves. Is it clear? Is it clear? Any doubts in this? So C comes first. So the first heart sound, okay, that is because, remember, the first and the second heart sound is because of the closure. Okay, so because of the closure of the AV walls, because of the closure of the AV walls, it is the first heart sound. And because of the closure of the, and because of the closure of the semilunar walls, it is the second heart sound. Okay, and I'm telling this thing to remember because exams में एकदम से haphazard हो जाता है, you don't remember. So C comes first. So C, isovolumic contraction, that is first heart sound, and R comes after, that is second heart sound, that is closure. Now the third heart sound, okay, it is because of the first rapid filling of the ventricle. Okay, the third and the fourth heart sound, they are normally not heard. Okay, ज़्यादातर ये नहीं, we just hear first and the second heart sound, but the third heart sound, it is because of the rapid filling of the ventricle. एकदम से ventricle में rapid filling हो रही है, उसकी वजह से there is third heart sound, and it is seen in hyperdynamic conditions like in pregnancy. Okay, like in pregnancy or anemia. So it can be seen in physiological conditions also. Okay, it is because of the first rapid filling. But the fourth heart sound, it is always pathological. Remember, it is always pathological, and it is heard during the last rapid filling because of the atrial contraction, atrial kick, the atrial kick which was causing the last rapid filling of the ventricle, that is producing the fourth heart sound, and it is always pathological. It is always pathological. So if fourth heart sound is present, that means it is pathological, and it is because it is seen when the ventricular muscle is stiff. When the ventricular muscle is stiff. And diastasis, that is the slow filling. ठीक है, स्लो फिलिंग के वर्क ऑफ द वेंट्रिकल, नो हार्ट साउंड इज हर्ड. नो हार्ट साउंड इज हर्ड. इज इट क्लियर? एनी डाउट्स इन दिस? डॉक्टर एहसान, डॉक्टर सेजल, डॉक्टर मोहम्मद, एनी डाउट्स टिल नाउ? Please remember, they can ask you about the cardiac cycle and the heart sounds. ठीक है, कार्डियक साइकिल को हर समय वेंट्रिकुलर रिलैक्सेशन, द डायस्टोलिक फेज, प्रोटोडायस्टोल, आइसोवोल्यूमिक रिलैक्सेशन से याद रखना. ठीक है, तो फिर इजीली अपना सारा जो साइकिल है, इट विल बी क्लियर टू यू एंड यू विल रिमेंबर इट इजीली. ओके, नाउ I told you about the cardiac cycle. Okay, then I told you about the sounds. Now ECG में P wave is because of the atrial systole, right? So atrial systole is after P wave, and ventricular systole. Okay, ventricular systole is peak of R wave, after R wave, and ventricular diastole, that is the T wave. So remember, the P wave, it denotes the atrial systole, the R wave, it denotes ventricular systole, and the T wave, it denotes ventricular diastole. So this also you should remember. So this is about the cardiac cycle. Cardiac cycle के साथ I have spoke about the different heart sound, the first, second, third, and fourth, and also the ECG. Is it clear? Is it clear? Now coming to the next important topic of today, that is jugular venous pressure. That is jugular venous pressure. And this jugular venous pressure, we normally use the internal jugular vein. Okay, the internal jugular vein is used to measure the jugular venous pressure. Why? Because this internal jugular vein, it is in direct continuation with the right atrium. with the right atrium. So in jugular venous pressure, it is reflecting the right atrial pressure, which is the central venous pressure. Okay, I'm taking this topic today because tomorrow I'll be talking about the CVP monitoring. So you should be thorough with the jugular venous pressure. Dr. Ehsan is asking me to repeat hyperdynamic. Dr. Ehsan, I just told you that the third heart sound is because of the first rapid filling of the ventricle. See, here I told you, okay, because of the opening of the tricuspid or the AV valve, what will happen in the ventricular diastole? The blood will enter rapidly. Okay, the blood will enter rapidly from the atria to the ventricle. तो उसकी जो रैपिड, कहीं पे भी अगर तुम गश से अगर ब्लड फ्लो होगा तो दैट विल कॉज अ साउंड, ठीक है, एंड दैट इज द थर्ड हार्ट साउंड बिकॉज ऑफ द गश ऑफ द ब्लड flowing from the atria to the ventricle, that is producing the third heart sound, and it is mostly seen in hyperdynamic circulation. It is mostly seen in hyperdynamic circulation, like in cases when we are doing exercise or pregnancy or anemia. During that cases, we will hear the third heart sound more commonly or more easily. Is it clear, Dr. Ehsan? Dr. Ehsan, is it clear? Okay. So now I was talking about the jugular venous pressure. Okay, I was talking about the jugular venous pressure. Now this jugular venous pressure, it is measured in the internal jugular vein. Now why is it in the internal jugular vein? Because this internal jugular vein is in direct contact, it is in direct continuation with the right atrium. Okay, yes, Dr. Ehsan, so therefore it reflects the right atrial pressure. It reflects the right atrial pressure, and all of you must have seen this tracing. Okay, ये tracing पढ़ा होगा in the first year. This tracing is of the JVP. This tracing is of the JVP, and JVP, the jugular venous pressure. Okay, normal value is 6 to 8 centimeter of water. Remember this also. The normal value is 6 to 8 centimeter of water, and it has 3 positive waves, that is A, C, V. Okay, and 2 deflections, that is X and Y. X and Y are the deflections. Is it clear? Is it clear? So JVP, it is internal jugular vein, ठीक है, because it is in contact with the right atrium. तो JVP क्या बता रहा है? It is telling, it is reflecting the right atrial pressure. Please remember, it does not tell us about the left atrial pressure. JVP is reflecting the right atrial pressure. Okay, it reflects the right atrial pressure, and the normal value is 6 to 8 centimeter of water. It has 3 positive waves, that is A, C and V. A, C and V, and 2 negative deflections, that is X and Y. That is X and Y descent. Now, first of all, why these waves are there? Why A, C and V is there? And remember, A is taller than C wave. A is taller than the C wave. Now, the A wave, ठीक है, C wave, इसको ऐसे याद रखना, A से हम लोग एट्रिया कॉन्ट्रैक्शन के बारे में बात करेंगे. किसका? राइट एट्रिया. Everything I'll be talking about will be according to the right atria. C से क्या याद रखोगे? I'm talking about the cusp. And V से क्या याद रखोगे? I'm talking about the veins. Okay, so it will be easy for you. Okay, it will be easy for you. Now, the A wave, it is positive. It is positive. So positive कब होगा? जब contraction होगा, right? So A wave denotes the right atrial contraction. It denotes the right atrial contraction. So the A wave, okay, the A wave in the JVP, that is because the A wave which we are getting, Okay, that is because the A wave which we are getting, that is because the right atrial contraction. Now राइट एट्रिया ने कॉन्ट्रैक्ट किया, ठीक है, एंड दिस ए वेव इट पीक्स जस्ट बिफोर द फर्स्ट हार्ट साउंड, ठीक है. नाउ फर्स्ट हार्ट साउंड वाज बिकॉज ऑफ व्हाट, इट वाज बिकॉज ऑफ क्लोजर ऑफ द एवी वॉल्स, ठीक है, इट इज बिकॉज ऑफ द क्लोजर ऑफ द एवी वॉल्स. सो हार्ट ये एट्रिया कॉन्ट्रैक्ट हुआ और देन there will be closure of the AV valves. Now we will see the C waves. C wave याद रखना cusp. तो क्या हो रहा है, क्या हो रहा है, अब एट्रिया में बहुत ज्यादा ओके प्रेशर है, ठीक है, प्रेशर है. सो दिस इज बिकॉज ऑफ द बल्जिंग ऑफ द ट्राइकस्पिड वॉल्व, ठीक है. द ट्राइकस्पिड वॉल्व दे बल्ज इनटू द राइट एट्रिया ड्यूरिंग आइसोवॉल्यूमिक कॉन्ट्रैक्शन, ठीक है. जब आइसोवॉल्यूमिक कॉन्ट्रैक्शन होगा तो क्या होगा, उस वक्त the tricuspid walls they bulge into the right atria. तो वो जैसे ये हार्ट है, ठीक है, दिस इज राइट एट्रिया, दिस इज राइट वेंट्रिकल इज इन द आइसोवॉल्यूमिक कॉन्ट्रैक्शन, ये वाला वॉल्व भी बंद है. तो बिकॉज हियर द प्रेशर इज दिस cusp will bulge into the right atria and that will cause increase in the pressure in the right atria. Is it clear? Is it clear? Any doubts here till here? Any doubts till here? Dr. Ehsan, Dr. Muhammad, Dr. Sejal, any doubts till here? So because of the bulging of this tricuspid wall into the right atria, there will be increase in the right atrial pressure and that gives the C wave, and that gives the C wave. Okay, that gives the C wave. Now what we have is the X descent. Now what we have is the X descent. X descent का मतलब क्या हुआ, एकदम से एट्रिया का प्रेशर कम हुआ, ठीक है. तो वो कब होगा, एट्रिया का रिलैक्सेशन, बिकॉज ऑफ द एट्रियल रिलैक्सेशन. So the X descent is because of the fall in the right. अब यहाँ पे क्या हुआ था, एट्रिया का प्रेशर, एट्रिया कॉन्ट्रैक्ट हुआ, ठीक है. Now X descent is because of the atrial relaxation ends just before the second heart sound, ठीक है. That is because of the atrial relaxation. The X descent is because of the atrial relaxation. Okay. Now what will happen, there is another positive wave, okay, that is the P wave. V wave is veins. That means atria is in the diastole, it is receiving the blood from the atria ka diastole. That means it is receiving blood from the inferior vena cava and the superior vena cava, and therefore there is increase in the pressure in this, and that's why we have a V wave. Is it clear? That's why we have a V wave. And then there will be a descent, that is the Y descent, that is rapid emptying of the right atrium once the tricuspid wall opens, and it correlates to the third heart sound. It correlates to the third heart sound. Is it clear? Any doubts in this? Any doubts in this? Any doubts in the, see, the, if there is positive, ठीक है, if there is positive का मतलब हुआ there is increase in the pressure, there is increase in the right atrial pressure. So first A wave is because of the atrial contraction. C से क्या याद रखना है, C से याद रखना है, that is because of the cusp, that is because of the cusp. So that happens because of the bulging of the tricuspid valve into the right atrium, and that will happen during the isovolumic contraction. ये याद हुआ. V wave, atria is in the diastole, it is receiving the blood from the IVC and the SVC, that's why it is there. Then two descents, that is the X, okay, and the Y descent, that is the X and the Y descent, ठीक है. X descent is because of the atrial relaxation, and Y descent is because of the emptying of the right atria. So these are the characteristic JVP waveforms. Is it clear? And always remember, whenever we are seeing the A wave, okay, the A wave is more than C wave. It is taller than the C wave. Is it clear? Is it clear? Any doubts in this? Okay. Now, coming to different abnormal forms of JVP, abnormal JVP waveforms. Okay, that was a normal. Now, why there is A wave? A wave is because of the atrial contraction. It is because of the atrial contraction. So, large A wave का मतलब क्या हुआ? That means atria, right atria का pressure बहुत ज़्यादा increase हो रहा है. So it can occur because RA, the right atria, is contracting against the increased resistance. So when can it happen? It can happen if see, this is the right atrium, this is the right ventricle, or idhar valve hai, that is the tricuspid. Okay, that is the tricuspid. Now this pressure will increase. Atria is contracting against the increased pressure. So when can it happen? If this valve is stenosed, then, or if there is pulmonary stenosis, okay, then also there will be back pressure. So in pulmonary stenosis or pulmonary hypertension, in all these cases we will get large A waves. Is it clear? Large A waves is seen when contraction is against increased resistance. Now there is another important term which is known as Cannon A waves. ठीक है, Cannon A waves में याद रखना है the large A waves was because of against increased resistance. If the RA is contracting when the tricuspid valve is closed during ventricular systole, then we will get Cannon A wave. Okay, tricuspid valve is still closed, it didn't open, then we will get Cannon A wave, and that is seen in AV dissociation. Okay, that is seen in AV dissociation or the complete heart block. So AV dissociation mein we will get Cannon A wave. Is it clear? Now, absent A wave, absent कहाँ होगा? अगर atria contract ही नहीं हो रहा है. If the atria is not contracting, so what is that condition? That is seen in cases of atrial fibrillation. So these are the abnormal A waves. Is it clear? Any doubts? Now A, then उसके बाद क्या आएगा? C. ठीक है, तो CV wave. What is CV wave? The CV wave is, this is the CV wave. ठीक है, ये जो X descent है, that is getting masked. Okay, that is CV wave. Is it clear? This is CV wave. Okay, the X descent, it is getting masked. Now, why was X descent seen? That was because of the fall in the right atrial pressure during relaxation. So, CV wave is, okay, let me draw this. A, C, V, X and Y. Okay, this is causing one wave. The X descent is masked, so it will be like this. Okay, A, C, V, Y. Is it clear? This will be like this, the CV wave. The X descent is getting masked. This is because of bulging of the JVP during ventricular systole, and this is seen only during tricuspid regurgitation. Remember, the atria is not able to get relaxed. Okay, the X descent was because of the atrial relaxation. That was because of the atrial relaxation. So atria is not able to get relaxed, and that occurs only in tricuspid regurgitation, and it is also known as Lanzisi sign. This is also known as Lanzisi sign. Is it clear? Is it clear? The atria is not able to get relaxed, okay, and that is causing CV wave, that is X-descent is getting masked. It is seen only in TR, that is tricuspid regurgitation. Now, I told you normally, okay, normally here then the A wave, okay, it is more than the C wave and V wave. So what happens if A wave, okay, A wave is equal to the V wave? Okay, that means if the blood is coming from A wave is equal to the V wave when the blood is coming from the AST or constrictive pericarditis. Just remember these conditions. Just remember this condition. Okay, Dr. Ehsan Ali is asking me where is the CVP catheter position in the heart. Dr. Ehsan, I'll just tell you. Okay, I'll just tell you where the CVP is catheter position in the heart. The CVP catheter is positioned just above the right atrium. Okay, it is positioned just above the right atrium at the junction of the SBC and the right atrium. Okay, the normal, Dr. Ehsan is Ali is asking where is the CVP catheter position. Tomorrow I'll tell you this in detail. But for now I'll just tell the CVP catheter is positioned just above the right atrium. Is it clear? Okay, at junction of superior vena cava and right atrium. Okay, and right atrium. Is it clear? Any doubts in this? Guys, am I audible and clear? Any lag? Is it clear? I think there is some problem with the net. Dr. Esther. Okay, just give me a second. I'll just see what's the problem. Guys, okay. Dr. Ehsan, Dr. Sejal, Dr. Mohammed, please let me know any lag if I am audible. Okay. Guys, now is it okay? Now is it okay? Okay. Then it is better to continue tomorrow. Okay. I'll just try once more. See, I was talking about the A wave equal to the V wave. I'll just try to continue. The A wave is equal to the V guys, then I'll continue tomorrow because continue tomorrow at at 7:30 only, 7:30 p.m. Okay, and tomorrow I'll be taking a longer class. Then I'll be talking about the cardiac monitoring, that is BP, JBP, the CBP monitoring, and the pulmonary catheter monitoring. Okay, so I'm sorry for the net issues. I'll be continuing with this topic tomorrow. Is it clear? Okay. So, guys, okay, guys, then please let me know if now you are able to hear me. Now also, is there any lag? Okay. So, as all of you agreed